I'm Dr. Ajakwe, co-founder of Comprehensive Pain Physicians. Today I'm getting ready to perform a spinal cord stimulator trial on a patient of mine, Daniel Cinnamon. Daniel has had chronic low back pain and chronic neck pain for over 5 years. Today we're focusing mainly on his chronic low back pain. He has what we call lumbar post-laminectomy syndrome, as well as lumbar radiculopathy. He has had several spine surgeries to fix his back and lower extremity pain. Unfortunately, he hasn't been able to achieve the kind of relief that he has expected. So Dan, I'm going to ask you a few questions.
Mm-hmm.
Okay. How long have you had your back and leg pain for?
Started in '06. I got a laminectomy in '06 to relieve the sciatic pain down my right leg. And then in 2010, I actually broke my back at that same spot, which was L4, L5, S1.
Correct.
And got a fusion with 2 bars and 8 screws at that time. And then I've had a neck fusion after that another year later.
So you've had multiple surgeries.
Yes.
Now, currently, where is most of your pain? In your back? I know you have neck pain. We'll put that aside. In terms of your back pain, do you also have leg pain as well from your back?
Yeah, I've got neuropathy and pain. My right knee to the ankle, I don't feel it. I probably lost 40 to 50% feeling. And then my left thigh goes numb after standing 5-10 minutes. And then walking right now is increasingly hard. I have pain in the middle of my back that radiates each side, and then lower back a lot.
Okay. Now, you said walking is increasingly difficult. How far can you walk? 10, 20, 30 feet before you have to stop, or more?
I can go about 100 feet. I mean,
100 feet?
I have to stop and just take a break. Last night we walked through a Target to find my son a gift for his wedding, and
How was that experience?
I stopped 3 or 4 times, and by the time we got to the checkout, I had to sit down to take the pressure off.
Typically, on a bad day, on a scale of 1 to 10, how bad is your pain?
My pain range is 6 to 8 most all the time. I can get relief by pain pills or by laying down and taking a 20-minute break and then get back up. But separate issue, I've got a hip problem also, and that's making walking and getting up difficult.
Gotcha. Now, what other parts of your life were impacted by your pain?
Everything. I was a soccer coach. I don't coach soccer anymore. I can't spend the time out there. I can't kick a ball anymore. My work, I'm no longer able to work. I stay home, take care of myself. But even right now, I can't put on my socks. Barely can get dressed.
How about sleep?
Sleep, I actually take a sleep aid at night and take melatonin. And so I can get to sleep, but I do change positions frequently. I can't lay on my stomach anymore. I lay on my side and then rotate, and then I have to prop pillows up under my legs to keep the pressure off my back.
And relationship with your wife, that's been affected as well from what I hear?
Yeah, I'm a newlywed now, but yeah, it's intimacy has changed because there's certain things I just can't do, and we find ways to do things, but it's still changed my life a lot. Pain.
And right now you're taking a few different opioids in addition to other classes of medications to control your pain.
Right.
You're on long-acting morphine.
Right.
15 milligrams twice a day.
Correct.
And you're also on Norco 10-325.
Right.
3 to 4 pills a day.
Yeah, as needed. I try to take one in the morning and usually be mid-afternoon. The problem is I usually wait too long and then I'm already in pain and then I'll take a pill. And rather, I don't like just taking them on clockwork. I know that's a way to stay ahead of the pain, but I'm trying to reduce the amount of opioids that I'm on.
Okay. So as you can see, Daniel has severe low back pain and what I would call severe limb pain. So he has trunk and limb pain, which significantly affects multiple aspects of his life. The goal of the Spinal Cord Stimulator trial is going to see if we can reduce not just your average pain scores, but also reduce the amount of pain medications you have to take.
Right.
Those
That's
all
what
have
I'm
side
hoping.
effects. Also try and improve your function, so by being able to improve how far you can walk, your endurance, how long you can stand and sit, your mood, your relationship with your people who are important to you in your life. So the overall goal of this trial, what's going to determine if it's successful or not, is going to be how this spinal cord stimulator system impacts all these measures we've just spoken about.
Right.
Okay?
Yeah, the one thing we haven't talked about is mood. I'm normally a pretty happy-go-lucky. I mean, I try to stay in a great mood, but the pain has got to me at points to where my tolerance is down. And I still remind myself, if this was 20 years later or earlier, my pain would be very intolerable. I would not handle it well. But that's one thing I'm hoping to improve, that the pain level goes away and it will actually help my overall look at life.
Outlook.
Yeah.
So I expect to have another interview with you in about 5 to 7 days. At that time, you would have had the medical leads, spinal cord stimulator system, in your bag, and I'm going to ask you some of the same questions again. At that time, we'll get to see what kind of impact the system has had on these measures we just discussed today.
Yeah,
Okay?
I'm definitely hoping for a good outcome.
Okay, me too. All right. So I'm going to take the patient back to the procedure suite, and we're going to perform a spinal cord stimulator trial today with a new system. This is the Nevro system. The major difference with this system is that this is called a high frequency 10,000 kilohertz spinal cord stimulator system. Recent studies have shown this system to be superior to what we call traditional spinal cord stimulation that we've used for years. And this system is also supposed to be able to help patients with back pain in a much more reliable fashion than the older systems we've used in the past. So I'm very optimistic that we'll be able to make a big difference in your life with this system, okay?
Absolutely.
All right, so we'll get started. Okay, right now I'm getting ready to start the procedure. The patient's back is being prepped with Hibiclin solution. Even though this is a percutaneous procedure, we still have to maintain sterility. The patient has also received a gram of NSAID. And the patient's also currently under very light sedation. My insertion points with a local anesthetic. This should not be a painful procedure if the patient is well anesthetized. Daniel?
Yeah.
I'm going to be injecting some local anesthetic into your back here, okay?
Wonderful.
This is going to sting a little bit for a few seconds, okay?
Okay.
Doctor, are you going to use the second one?
Give me a few seconds before everything's up. You can open that. Alright. Daniel, while I'm doing it, I'm numbing you up with some lidocaine and some marcaine, okay?
All right.
The medical wires have to be inserted into the epidural space. They get inserted through a needle. This needle acts as an introducer. I'm going to be placing this needle into the epidural space using what we call a loss of resistance technique. Can I have a glass syringe, please? Okay, we wait for about 2 minutes. The patient should be relatively numb.
Okay.
I'm going to test him a little bit with a smaller needle first to see if there's much pain there. Looks like we're doing pretty good. This procedure is always performed with guidance from the X-ray. That's okay. I know. You can always move around. My target point is right here. Okay. How you doing now? No pain there?
Yeah, felt that.
Okay, I'm going to give you some more local anesthetic, which I do have here. Again, this should not be a painful procedure. This is called a loss of resistance technique. When I'm in the epidural space, there should be a rush of air into that space because it's a vacuum.
Felt that in my left foot.
On your left foot. Let's go lateral.
High dose after?
No, it's pretty good actually. Come back to AP.
I'm gonna say that one?
Not yet. See. We're trying to secure these leads. We're almost done. I don't want these to have any chance of coming out during the trial period. Just to figure it out.
Check it in, doctor.
Got it.
Good?
And then one more. The last one. Okay, let's get them off the table. He's done great so far. That's probably... Okay, so this was a successful spinal cord stimulator trial using Nevro. We're going to follow the patient over the next 5 to 7 days, and we're checking for reduction in pain, and some of the other measures we talked about including function, mood, sleep, reduction in medication use, and if he has a successful trial, we're going to go ahead and implant him in on a future date. Okay? Thank you.